the big news is the French thing. The French authorities have withdrawn some breast implants. That's big news in plastic surgery world. Whether it's a big news in the world out there, I don't know. But the French have withdrawn textured silicone and polyurethane foam coated implants because of the association with ALCL, which is a type of cancer that's associated with breast implants, well, with those types of breast implants. So that is something that's a lot of people are talking about. Rightly or wrongly, I sent an email. What's that? Sent an email out to all my patients and told them about this. I did have a bit of angst about it, whether I should do that, because I don't want to worry people, because basically the bottom line is, the advice is there's nothing to be done. Even in France, where they've banned the implants, they're not suggesting the implants need to be removed or anything like that. And the rest of the world haven't withdrawn the implants. So the rest of the world is still using the implants. And so there is nothing to be done. So the only reason I emailed people was so that they knew. I thought getting it from a sort of reputable source would be good. And but I don't want to sort of, I've had quite a lot of replies back with people who are concerned, and obviously because it sounds bad, but and I've said to everybody that they can come back to clinic, because if you're worried, then they always say the advice is to, you know, always get things checked out if you're worried. But ALCL, which is the reason these implants have been banned, is diagnosed by having a lump or a swelling in the breast, and that is something that people will know themselves. So patients will come. Does it look like that thing's growing out my head? Should I go to the side of it? So that is something that you will know yourself if you. I could have set this up better, couldn't I? I could have had one of those operating lights in the background. Oh well. So you are absolutely more than welcome to come back to clinic and get checked over. But the advice is there's nothing needs to be done, and the advice would have been that you should come back to clinic and get checked over if you're worried anyway, if this wasn't announced. Now the thing about it is, I will have to see how it pans out with the rest of the world, but ALCL has been a bit of a funny thing, and we've spoken about it for a while now. It's been going for a few years, and it's all a bit odd, because the first thing to say about it is very rare. The other thing to say about it is quite a recent thing, and implants, these textured implants, have been around for a long time. So you think if it's been a thing, then why is it only just coming now? Why have there not been cases in the past? And it may be that we've got different ways of looking at it, and it may be that a lot of cases didn't cause any problems. It's a cancer of the capsule. It's not a cancer of the breast. So it's not breast cancer. It's a cancer of the capsule. And we never used to send away the capsule when we did capsulectomies. We used to just throw them away. So it might have been there and we wouldn't know about it, but if it didn't cause any harm, does that matter? That's the problem. There are some cases of death from ALCL, but they're very, very rare. And most cases are actually cured by removing the capsule. So it is a curable disease, and it's difficult because it's a bit like, is it like this or not? It's a bit like, let's say you invented the train, and then you invented the car, and then loads of people died in the car. Well, not even loads of people, some people died in the car, and you thought, well, cars were not safe. we're going to outlaw cars and just have trains because they're safer. You could say that if a country did that, you could say that that country was being looking after its population because it's saving them from dying in cars. But there are good things about cars. You know, the reason that they went from trains to cars, I think they didn't go that way around, did they? I think cars were probably before trains, but let's just say they did. Let's just say trains were invented first. The reason they went from trains to cars is because there's good things about cars. And so to deny people cars is not necessarily a good thing. You should talk to people about the risks of driving in cars and let them decide. Anyway, I'm not sure if that, maybe I should have thought that analogy through a bit more, but maybe that, but basically the problem is that, and again, the messages are not that clear because it used to be that they said that there were no cases of ALCL, pure ALCL with people with smooth implants in. So smooth implants are not affected in this, the French thing. It's only textured silicone and polyurethane. Now, patients of mine who are contacting me, and Laura's saying, I've got Nagel over the muscle implants in, and I'm wondering, should I be concerned or will it be okay? I use Nagel, assuming they're Nagel in Pleo. Most people in this country use textured implants, and the vast majority of the implants that I have used, and to be honest with you, still use, are textured implants and polyurethane implants. So are the implants that they ban in France. And you might say, why don't I just go to smooth implants? And some surgeons have gone to smooth implants, and maybe some patients will start asking for smooth implants. In fact, some have already, and that's fine if you want a smooth implant, because they say there's no cases of smooth implants developing ALCL, although I did hear from one of the implant manufacturers last week, was it this week, that there was a case, but I haven't really had a chance, well, I haven't really found that, verified that, but so there might, if there is a case of smooth implants, and that puts a bit of a spoke in that one, but they were saying that there's no cases of ALCL with people with smooth implants. You might say, well, I'll have a smooth implant then, which is fine, and you can have a smooth implant, and that's fine if you want a smooth implant. The problem is, and the reason why I think a lot of plastic surgeons were a bit like, oh, is because smooth implants were the first type of implants. When they first made implants, they made them smooth, a bit like the train. Well, only the train wasn't the first thing, but let's just, you know, it's the first generation, they call it the first thing. And then they made refinements in it by making the texturing, by making the polyurethane, things like that, to improve them. And so we thought they were improving them, and the texturing helps the tissues, stops the implants from moving, basically. Smooth implants move about all over the place. So basically, you can't have teardrop. If you want teardrop, forget it. You can't get a smooth teardrop implant because it would just wobble about all over the place. And capsular contracture, the scar tissue forming around the implant, is increased in smooth implants. So, and that might need another operation, which has got risks associated with it. So I'm not sure whether, you know, whether you can say it's safe for what they're doing by withdrawing those implants, because you're potentially making all their patients have smooth implants, which could potentially have problems of their own if you need reoperation sooner than you would if you had a textured or a polyurethane implant. So I follow the view of ISAPS, the International Society of Aesthetic Plastic Surgeons, and I think that it's about talking to patients, empowering patients. That's something I've always been about, you know, a long time now. So I wrote my book. Where is it? I've got a copy of it. But anyway, Never Accept a Lift from Strangers, available from Amazon, or neveracceptaliftfromstrangers.com. Free if you get it from my website. Pay for it and everything. Anyway, so yeah, it's all about empowering patients. The same thing about botched surgery and dodgy surgeons and all this. It's about empowering patients and giving patients the information so they can make an informed decision about whether they have cosmetic surgery at all. Because all these people say, oh, people shouldn't be having cosmetic surgery and it's terrible and it's all evil and it's all wrong and you should be doing something better. But, you know, it does improve quality of life, and breast implants do improve quality of life, and they make people feel a lot better about themselves, and there are good things about them. But they have risks. And ALCL is there, but it's so very small. There are other risks. You can get infected, you can get rippling, you can get malposition, you can get displacement, seroma. There's all sorts of risks you can get with breast implants, and you have to balance the risks against the benefits. And so ALCL is a risk, and that is why they remove them from America, but from France. But to put it in perspective, the risk is so small, and I think the problem comes when you get this. The worry that I've got is if the media take it, and then people think, I've had loads of people emailing me and contacting me saying, I'm worried about my implants. Have I got these implants in? And I'm like, yeah, you got those implants in. Yeah, if you've got polyurethane, if you got pretty much, if you got me, I mean, I have put some, hardly any smooth. You know, they're going to be those implants. They're going to be textured implants. They're going to be polyurethane implants. Those are the implants I have used before, but I will still use. Although I'll talk about patients about ALCL, and I've talked about it before. So you might well have those implants, just like Laura's got Nagel, which are probably textured, because I mean, someone said to me earlier about well, they asked about Belite and Mentor. Now Belite are textured silicone implants, so Belite are affected. They won't be able to use them in France. Mentor, just like Laura, who's saying I've got Nagel, Mentor are a company that make smooth implants as well as textured implants. So just by saying Mentor doesn't necessarily mean you've got one of the affected implants. You could have a Mentor smooth implant. You could have a Polytech smooth implant, or a Nagel smooth implant. So Mentor is the make. So they do make smooth implants. But in this country, we have used majority of the surgeons use textured implants. So a lot of people will have these implants in. But the advice in France, and even when they banned them, and certainly in this country, is you don't need to do anything. You don't need to change your implants. You don't need to worry. ALCL is extremely small. The risk of ALCL is extremely small. And if you do get ALCL, it presents as a lump or a swelling. So if you get a lump or a swelling in your breast, you have to go back to your surgeon, which is what we would have said to you anyway. If you get a lump in your breast or swelling in your breast, you should go back to get checked out by your surgeon. But if you haven't got any symptoms, obviously you can come back to clinic if you're worried. Come back and we'll see what, talk to you and examine you. But you don't need to worry if you're asymptomatic and you have implants in. There's absolutely nothing to worry about. Although I understand it is a worry when you hear, oh my God, they've banned these implants. Yeah, to put it in perspective, the risk of ALCL, it's a funny one, because as I say, it has just come recently, and it does make me wonder. It's a bit like a bit like things like DCIS, which is like a type of cancer in the breast. It's like early breast cancer. It's pre-invasive breast cancer, and one of the problems is that we are getting so much better at diagnosing DCIS, things like that. Our scans are so much better. They pick up little bits of calcification, that we can target that and biopsy that so much more accurately, that we're actually diagnosing a lot more DCIS now. The problem is we don't know what would have happened to that DCIS if we hadn't diagnosed it. And it may well be that a lot of people would have had that DCIS, would have lived a long and happy life and died of something else, and we'd have never known. But now we've got these techniques to diagnose it. We're diagnosing all over the place, and we're thinking, oh my God, there's always DCIS. And we can't do a study now where we randomize. I mean, the idea when you do medicine, if you want to know what happens, you do a randomized controlled trial, which means you get a group of people with a problem, and you randomize it. You randomly say, look, I'm going to treat you, and I'm not going to treat you. Or better still, I'm going to treat you, and I'm going to pretend to treat you. So you think you're being treated to take out the placebo response. So, you have this bit difficult with surgery, but you have this tablet, you both have a tablet, which looks the same, tastes the same, but one's got the active drug in it and one hasn't, and you randomize people that. You can't do that with DCIS. You can't say you've got a precancerous condition of your breast. Will you go in a trial where we randomize you to having treatment versus no treatment? Because we want to see if it gets worse and kills you, or if it doesn't, or if it doesn't cause you any bother. You're not going to say, yeah, of course. Just see if it gets worse and harms me. Are you? You're going to say, flipping it, get it out. I don't want a limiting trial. So we can't do the trial. So we don't know. So it's a bit like that. You know, it might be that we're diagnosing it better. We're sending out all these capsules now when we do capsulectomies, and they might be finding the ALCL. We think, oh my God, ALCL's all over the place. It's all terrible. It might have always been there. I don't, you know, because we didn't send the capsules. We often went a bit there. So basically, I don't know. I don't think anyone knows. It's a definite worry. It's a definite worry, and you need to be aware of it, and you need to make a decision as to whether you're going to have implants at all, and if you are, whether you have smooth ones or textured ones. But yeah, textured ones are. Oh God, I've got. Oh my God, I haven't seen any of these comments. Sorry. Oh God. I'm on a different thing. Oh God, I've got to scroll. Sorry. Oh dear. I was going to say something. I'll make my point. What's my point going to be? About textured implants. Yeah, I mean, there's pros and cons, basically. Oh yeah, so the risk of it is very rare. Did you see that? There's a study about the, I've got on my blog, just on a blog about this, but I did a blog about ALCL. I think I looked at it, it's like, was it 18 months, 2 years ago? It was a while ago, I think I did a blog about ALCL. Well, my freeze. But ALCL, the risk of dying from ALCL is so small. It's like drinking, was it a bottle of wine, or no, going to New York for 2 days or going skiing for a week. The risk of those things was each of those was twice the risk of dying from ALCL. But you'd have no qualms about going to New York for 2 days, would you? But your risk of dying, if you go to New York for 2 days, is double the risk of dying if you have textured breast implants for life. Similarly, going skiing for a week. If I said to you, look, you know, if you're skiing, you could die, you'd be like, yeah, but I probably won't, but yeah. It's like, you know, you go and drive on the motorway, you could die. I don't know if that's helpful or not, but anyway, it is a very rare thing, is the point. Sorry, Laura, sorry, because are these with all textured implants or just the company in question who have taken them off the market? Right, Rebecca, what you're going in there, Rebecca, is a little while ago, Allergan didn't renew their CE mark. So that's one company didn't renew their CE mark. I think because of ALCL, it wasn't clear, but that was a while ago, and that was happened in this country, Rebecca. What's just happened now is the French, and this is the French, not us, have just withdrawn all textured implants, and well, polyurethane is only made by one company, but all textured implants. So it's not just the company in question, it's all textured implants in France, not in the UK, in France. In the UK, we're still using them and all that, and to be honest with you, in the UK, nothing changed. Because we were already telling people about ALCL. Ellie, this isn't for me to worry about, is it? I hope you're all okay. I'm fine, Ellie. It's not for you. It's not for you to worry about, Ellie. But I think you have got textured silicone implants. But it's not. Don't worry about it. I know it sounds bad, but you know, don't worry about it. We're still putting them in. It's fine to put them in. They're good implants. There's a very rare cancer associated to them, which is extremely rare. 1 in 30,000, 50,000, depending on the figures you look at, and it's very curable. Breast cancer is 1 in 8, and it's not very curable, so it's very curable. Rebecca, is this more likely to happen after a 10-year period? Rebecca, I think the sort of mean time for it happening is about 8 years. So it happens about 8 years, ALCL this is. So yeah, even after a 10-year period, you've got to look out. It happens some years after having the implants in. Laura, Nagel and Player, so they are textured silicone implants. So that is the type that has been banned in France. But don't worry about it because we're okay with it. Can I, oh dear, Laura's asking the price for implant removal, please. Oh God. I don't know, Laura. I think it's, I think it's between £3,000 and £4,000. I don't know, Laura. Can you put your email, Laura, or can you email us and we'll email you a thing which tell you the price of implant removal. Samantha, what is your advice now? Do you favour smooth over texture now? No, Samantha, I don't. We've known about ALCL for a couple of years, Samantha. And I have told people, and every time someone comes to the clinic and talks about implants, I send them an email which says about ALCL, and there's no cases of smooth implants. But I still, and even now, I don't particularly think it's, well, I shouldn't impose my, well, you know, my view is I don't particularly think, you know, I think textured implants are better than smooth implants. I think they've got benefits, you know, but I think I can understand if someone comes and says, look, I don't want that ALCL thing, I want those smooth ones, give me those smooth ones. I'm like, fine, you know, the smooth ones, no problem at all. I've got no problem using smooth ones. I've never had a problem using smooth ones. I just don't think they're as good as textured because they're more likely to cause problems. I mean, you might argue ALCL can cause problems, texture can cause problems, but as I say, it's a balancing the risks. So my advice now is the same as it already has been the last few years, which is there is a type of very rare cancer associated with textured implants, but it's very rare and it's curable, and it's and these are the good things about textured implants. Tracy, after hearing all this, I'm still going for textured B-lights. Absolutely do not want smooth implants. I've had DCISS and Paget's disease of the nipple, and I'm still happy to go with the textured implants. But there you go, Tracy. I think I agree. I mean, I think it's not like there's an option which is better in every way. The option's got its own problems. You know, smooth implants have got their own problems. But as I say, people might go with that. Laura, can I ask how much it is, please, to get my implants out, please, and how would I go about this? Laura, you've already asked, sorry, I missed it last time. Yeah, sorry, Laura. It's not that bad, Laura. It's not that, well, if you want your implants out, Laura, fine. You can have your implants out. I don't want to sort of, you know, that's fine. And I understand that. For peace of mind, you might say, that's it, I've had enough. But you have to accept the loss of volume and loss of shape. But yeah, that is an option. I trust you. Thanks, Ellie. Thank you. I've had an appointment to see you in June. I'm glad these are surgeons like you out there to advise people. Thanks, Rebecca. So yeah, that is the French thing. I accept it's a worry and I accept that it's a concern, but we have known about it for a couple of years. It's been a thing for a couple of years, and the rest of the world has not withdrawn these implants. The rest of the world has said it's okay. If we thought that there was a problem, we would have withdrawn them. They are okay. There's nothing to be done if you've got them in, except keep an eye on your breasts, which you should keep an eye on your breasts anyway, because breast cancer is so common and so much more common than this. So you should keep an eye on your breasts for lumps and bumps, whether or not you've got implants in, to be honest with you. So it's important to keep an eye on things anyway. So, sorry about missing all those comments. God, that's good, isn't it? So that's ALCL and that thing, and the breast implant thing. If you've got any questions, please feel free to ask.